So we are a team that really covers from kind of naught onwards. We have a child and youth team. The referral for that is through a GP, but the child and youth team also do attend to crisis. They do therapy. They have a consultant psychiatrist based in Brisbane, so they have something very trendy called an EKIMS model. So they link up with a psychiatrist in Brisbane over video conference. I'm on the adult team, and we're quite a small team. We do a variety of things. So the really good thing to know about us is that you can just walk in office hours. You can knock on the door and say, I want to talk to somebody, and usually we respond quite quickly. And if we're not the right service for you, we will help you find the service that you need to find. Sometimes that is about going back to your GP and getting a mental health care plan. But often we'll do quite a big workup with you and try and understand your context and how things are for you. So really helping that kind of conversation that you have with your GP, if that's what you go and do and have a mental health care plan. We do a variety of therapies, so sometimes we work with people really long term. So we have a range, and we're really lucky actually that we've been trained in a range of therapies in mental health, so we're really moving towards trauma-informed care. So we work a lot with people with diagnoses such as PTSD. We do mindfulness, we do something called acceptance commitment therapy, which is really about having a look at the beliefs and values that you have around your life, and are you living a life that's in line with them? Are you getting what you want out of life? Or there are things that are happening, perhaps it's a black dog, perhaps it's the anxiety, fear thing that are getting in the way of making your life really meaningful. Because when our lives aren't meaningful and when we're not living in line with the things that we believe in, often that can cause difficulties, and it can cause us to be down, and it can interrupt our sleep, and it can cause overeating and things like that. So that's another treatment we do. We also do something called dialectical behavioural therapy for people with a borderline personality disorder. So we're not just an acute response service. We're not a service that just does assessment and then helps you to go to your GP. We actually see people for longer term. So you can just walk in, you can go and see your GP, and your GP can refer you. Often the hospital refer people to us, the watch house refer people to us, the police refer people to us. And like I said, sometimes that's a one-off, or sometimes that's seeing people on an ongoing basis. We have a psychiatrist who is with us once a week, and we have a junior doctor who's with us kind of once a fortnight. So we're not kind of super staffed, we're not a huge team, but we do try and do the best. And I just think the turnout tonight is absolutely amazing. I think, I really like being part of this community. I think there's a real warmth to this community, and I think that mental health have a really good relationship with the hospital. As some of you will know here, that the hospital, we're really lucky in Mariba, has an outpatients department GP clinic, and I can see some people in the audience tonight who work alongside those GPs, so we're super lucky to have that as well. Well, I'm going to be on the panel later, so anybody that has specific questions about the service, and I guess Grant and Janelle are going to talk about as well. And we are a team. We're a team of mental health professionals. So we have the hospital, we have the GPs, and we have a range of non-government organisations. And then there's kind of mental health. And it's interesting that the flyer is The flyer is a jigsaw and putting the pieces of the puzzle together. And I guess the mental health team and the mental health services in Mariba are a bit like a jigsaw puzzle. And we do really try and kind of work together well to support people. And often we are seeing people who have a private psychologist, they have a GP, and they also come and see us. So it's not sometimes an either or, sometimes people get their support from all of us. We do see older people as well, and we do have an older person's team in Cairns. They are quite a small team, they have quite a big area, so we end up doing some of those. So I hope that gives you like a really kind of quick overview about where we sit in the landscape of things. So I just want to spend, I just want to spend the last bit of my time talking about depression and mindfulness, something that you mentioned before, and Janelle Wilkie, a psychologist, is really going to fit the other piece of this and talk about anxiety and mindfulness. Janelle and I are both quite passionate about mindfulness. I do mindfulness-based therapy, and I do it myself. Actually, I meditated before I came here, try and calm the anxiety down before speaking to you lovely people. And I really do think the science around mindfulness is growing. The science is quite young. It's only been the last couple of decades. And there are about 4,000 research articles around mindfulness and mental health. And we are really young in the journey of understanding around the brain and mindfulness and how it works. So I'm just going to pick something quite small about mindfulness, but I just want to say that mindfulness, for those of you who don't know, is really about paying attention on purpose, being aware in the moment, to be fully in what you're doing. So an example would be, if you're having a conversation with somebody, you're fully in it and you're able to listen, and you're not kind of concentrating and thinking about what to do for tea or the argument with the husband for the day before. You're fully in your life and you're experiencing it. And I guess that when you start to practice these things is when you're eating, you're eating. When you're with somebody, you're with somebody. When you are doing a task, you're in it. And the whole point of this is it helps kind of quieten the mind a little bit. We just heard that depression is the, oh my goodness, I can't do it, and it's all bad. And that anxiety is like the fear, the worst thing's going to happen. And mindfulness really helps us get a little bit of perspective around those voices in our head. Because we all have those voices, even if we're not depressed or anxious. We all have our internal voice that tells us, it's like a running commentary on our lives, and sometimes it gets away from us, and sometimes it gets super negative and it gets us down. So the part of mindfulness that I want to talk about really is compassion, and I think that's super important after a community loses somebody. I have had quite a few clients who have struggled quite a lot after Mark's death, and I think that's natural. I think that people in this community felt very connected to Mark, so I think that's completely natural. It's kind of part of the grieving process. And I think extending compassion to yourself when you've lost somebody, and compassion to the community who have lost a very important figure is really important. And that's really why I wanted to speak about compassion. So all compassion is showing concern. And it's important that we learn to show concern for ourselves, because if we can't be concerned about ourselves, we can't show concern for others. So I'm just going to talk about some simple steps really around compassion and depression that you can do. So the first one really is about starting small. It's about choosing one thing that you could do. So it may be, I really want to go to the cinema for ages, and all I end up doing is things for other people, and I'm running around all the time. I'm just going to carve out a bit of time, and I'm just going to do something for me. You know, I've had an aching shoulder, and I've been told myself for ages that I'm going to get a massage, you're going to go to the physio, so I'm going to do that, and I'm going to actually do something for myself. The second thing is about experiencing your mind without judging it. So it's not, here I go again, my thoughts are always negative. It's about kind of getting some distance and realising, there's my mind. It's being quite negative today. So we don't kind of own it completely, so we get some distance. It's also about becoming curious. You know, what is it that I would say to a friend who is suffering? Yeah? Because often the things that we would say to somebody in our life that was suffering, we would be kind, we would be compassionate, we would be caring, and often we're not like that to ourselves. The next thing is about interrupting our own thought process, rumination, when it kind of goes round and round and it won't stop and it's going over and over those things. We've all experienced that. We don't need to be depressed to kind of experience that thought process. So interrupting that rumination by kind of refocusing. So that might be doing some deep breathing. It might be catching up with a friend that you haven't caught up with for ages. It might be the starting small and the doing something nice. Number 5, my baby, would be practicing yoga and meditation. I know that's not for most people, but I think yoga and meditation and a minute breathing exercises meditation really gets us to, and there are loads of yoga courses in Mariva, is about getting us to kind of be in our body and practice some breathing. And the 6th thing, really following on from our last speaker, is the ability to know that you're not alone. I think that you talked about 45% of people. I think that most people struggle sometimes with our emotional health. And whether it gets to a clinical depression or anxiety, I think there would be not one person in this room who hasn't had a dark time. so can completely understand what it's like to struggle with your emotional health. When we are in difficult relationships, when things aren't going our way, our mind tells us things, and sometimes we don't need to believe it all of the time. Yeah? We need to realize that when we're feeling that way, there are probably millions of other people in the world who are also feeling that way. And I think that, again, thinking about communities, the last speaker said that when we can share our feelings in our own mind and know there are other people who feel this way, and when other people feel really depressed and anxious, they've gone and got help, and it helps. So, you know, we're not alone in our poor emotional health sometimes, and we're not alone in being afraid to kind of go and seek help.